old fibroid and is growing faster. See the irregular border? It may look like a malignant. And because of this type of borders and surface and the look like heterogeneous, if there's a multiple of this type of fibroid, the whole uterus is get deformed with lot of shadowing, and you cannot see the uterus very clearly. The uterine cavity, cervical line, you may not see clearly because a lot of shadow is coming and the uterine out border is irregular. Okay? If one of the fibroid is here, just understand that. Okay? If it's like that, the whole uterus is bigger in size, irregular outline, contour is lost, and a lot of shadow, calcifications, even necrosis, you can see it. Hardly you can see the endometrium, I'm telling you. And it can happen that this girl is 33 years old and having no baby yet. What is the advice you are going to do? She wants baby. She is saying, I'm having period every month, but sometimes irregular, sometimes heavy, but I'm having every month. Why I cannot get baby? Then you have to explain that, look, your uterus is almost taken by multiple fibroid and no space inside. So if fertilization, the mechanism of fertilization and implantation and the growth and development of the fetus is very challenging now. So uterus may not give any product. Okay, so this is the situation. Okay, I hope you understood the sonographic appearance and of the fibroid, and now I will go over the adenomyosis. Adenomyosis. Adeno means gland, myo means muscle, and the cis means process of growing. So adeno in the uterus, adeno means endometrium. Myo is myometrium. Endometrium. That means growth of endometrium through myometrium. As we know that normally every month there is a growth of endometrium towards the end cavity, towards the endocavity, right? Towards the endocavity there is a growth every month. But now if you see that endometrium this endometrium, okay, let me make it a little brighter. And now if you see, this endometrium is growing through the myometrium. Okay, this is myometrium. Now understand that this is myometrium and this is endo. Look at the growth. It is growing through the myometrium. The endometrium is growing through the myometrium. And as we know that endometrium is more brighter sonographically than the myometrium, so it will be more bright area inside the myometrium while you will be scanning, and as you know that this endometrium will bleed every month, because this endometrium is bleeding every month. Here there is a bleeding and there will be also bleeding here inside this. So as a result, what are you going to see? You will see the partly hyperechoic, and inside the hyperechoic there is hypo or anechoic area. Okay, so this is hyper because of the endometrium. Let me draw it little fancy. So this is endometrium. Okay, and inside the endometrium, what you are going to see, there is a bleeding every month and it collects here. Okay, and as a result, sonographically we call it switches appearance. Switches appearance. Let me see spelling here. SWISS. Yes. Switches appearance. SA. Okay, so adenomyosis. This is a rare condition in which the endometrial tissue invades the myometrium. Etiology. It is found in 40 to 60 years old multiparous women. Okay? 40 to 60 years old multiparous women, means mostly it is after menopause. but it can happen before menopause. Signs symptoms are dysmenorrhea, means painful menstruation, and metrorrhagia, irregular menstruation. Irregular menstruation. The sonographic appearance, an enlarged uterus with multiple hyper and hypoechoic areas within the myometrium. Often we call it Swiss cheese appearance. So this is adenomyosis. So patient age group is 40 to 60. And patient will have painful period and irregular bleeding. Uterus could be enlarged. Now doctor will give the advice for ultrasonography, and you are doing ultrasonography and you found that hypoechoic area followed by hyperechoic area, and it gives the Swiss cheese appearance. So this is the key word for this disease diagnosis, Swiss cheese appearance. Okay, so this is your adenomyosis. Now I will go over endometrial hyperplasia, then endometrial polyp and cervical polyp. I will do an cervical polyp. Endometrial hyperplasia. Okay. Endometrial hyperplasia. Endometrial thickness gets bigger because of the hyperplasia. What is hyperplasia? Enlargement of the tissue due to the increased number of cells. And what is hypertrophy? Enlargement of the organ or the tissue due to enlargement of the individual size of the cells. Okay, so endometrial hyperplasia, you need to evaluate. Some patient is having irregular bleeding or menorrhagia. You scan and you found that endometrial thickness is 2.5 centimeter. Then you have to understand what is the normal size. Then you have to ask what is the LMP. Okay, so normally endometrial thickness goes with the phase of menstruation. There are three phases. One is the menstrual phase, another is proliferative phase, another is secretory phase. Menstrual phase is shading out, right? You might see 1 to 3 millimeter thickness, if you can see it. For proliferative phase, you might see 3 to 6 millimeter. And secretory phase, I'm going to say include the ovulation time. So usually it is 1 centimeter. Okay, so proliferative phase I'm going to give say up to 8 millimeter. Take it. Secretory phase I found from 1 centimeter to 1.3 centimeter. It's normal. It's normal. I measure it and there is no problem. Even to be honest with you, I found 1.5 centimeter is normal. But in the textbook it says during the ovulation time and secretory phase should be 1 centimeter. And at that time you can see the triple line, okay? Triple stripe endometrium. Okay, so this is the normal, and we need to compare what we see now when the endometrium is hyperplastic. Okay, so now endometrium, correct measurement of endometrium is very important. Okay, so this is endometrium. You have to understand that if I draw a sagittal line through the endometrium, I have to measure the thickness at the widest part, making a 90-degree angle with the long axis. So this is 90-degree angle, right? 90 degree. And this is the correct measurement. From here, outer to outer, this is called endometrial thickness. We call it AP. Endometrial AP. AP means antero-posterior, which is known as thickness. Correct measurement is very important. Okay, so you measure the endometrial thickness and said you measure it, you found that examples 1 centimeter. And another case, you measure the endometrium and you measure from here to there and you found 2.5 centimeter. Okay, it's very big. Then we consider it as endometrial hyperplasia. So now understand that. What does the endometrium do? Normally it's shaded out during the menstruation and it bleeds. And higher the thickness, higher the bleeding. Because you know that endometrial in proliferative phase, secretory phase, it grows more with the glands and the arterioles, spiral arterioles and the venules. All those are shedding out, more bleeding. That's why patients suffer from menorrhagia. Too much bleeding, patient gets anemic. Okay? So this is the endometrium thickness. And who can have this thickness? You have to ask patient, are you taking any birth control pill? Are you taking any hormone replacement therapy? Are you taking tamoxifen? Lot of times the women after menopause, they get a bone density low, they are given low dose pills, hormone pills, that can cause hyperplasia. You need to ask patient all those questions you need to ask. And hyperplasia of endometrium is due to the response of the estrogen and progesterone. So you need to ask patient, is there any source? Are you pregnant? Not pregnant. Why are you pregnant? Just before coming in here, ask them. Is there any disease that causes increased level of estrogen and progesterone? Ask them to verify. Understand that you have to understand that this means overburden growth of or overabundant growth of endometrial tissue. It is caused by prolonged periods of persistently high level of estrogen. Okay? So then it could be any cause, iatrogenic or from disease. Usually found during one of two periods of woman's life which are immediately after menarche or following menopause. So in these two conditions it is common. It is common. Then you have to follow up what's going on. In postmenopausal women, there is a 20% chance of developing endometrial carcinoma. 20% chance of developing endometrial carcinoma from the endometrial hyperplasia. Okay? So now, what are the signs, symptoms with the patient will come to the doctor? The patient will come with prolonged period of bleeding, then postmenopausal bleeding. We call it DUB, dysfunctioning uterine bleeding. Patient get the menopause. Then what is menopause? Menopause is the time, there's a 1 year time, during that there is no period. If the period starts at 11 months, then patient has to wait another year to see the period continues or not. That means if you want to be declared as a menopause, you must not have period in 12 months. And patient will be anemic. Now, sonographic appearance, the endometrium will appear thicker on ultrasound, that is greater than 1 centimeter, and endometrium is hyperechoic than myometrium. There is no way to sonographically definitely or differentiate this process from endometrial carcinoma. I will discuss those, what are the differential diagnosis, and if metastases are seen in the pelvis or liver, and they are seen in the pelvis or the liver, then endometrial carcinoma is suspected. Okay, so now let me go a little more details. That you found that this is the situation. Then you need to understand what it could be. Is it simply endometrial hyperplasia, or it could be differential diagnosis of enlargement of the endometrium? Okay? Simply hyperplasia. Endometrial polyp. Then endometrial carcinoma, and it could be IUD. IUD then you can see the thickness. Okay, if it is simply a hyperplasia, I don't mind for that. As soon as you omit the tamoxifen or pills, it's going to go down. Make sure you need to report it. If it is an endometrial polyp, an endometrial carcinoma, patient doesn't know it, but you have to understand what is cooking inside. If it is IUD, patient will tell you that yes, I have IUD. Okay? Now, let me go one by one. How are we going to differentiate hyperplasia from the polyp and carcinoma? You know what is polyp? Polyp is a growth, benign growth, finger-like with a pedicle that grows from the wall of the endometrium and goes inside the cavity. It is homogeneous, hypoechoic, with a nice clean border with a pedicle, and the pedicle has the blood vessels. We need to click the color. So now let me so if this is the uterus, this is myometrium, and this is endometrium, and this is perimetrium. If you see the endometrium is thicker because there is a polyp, and this polyp has a pedicle. Okay? And even though this polyp can be as big as this whole endometrial cavity it occupies. So then we will see the whole thing is the same looking. Then how are we going to know what is this? Is it endometrial hyperplasia, or due to the polyp it is thickened? So that is one cause. Now click the color. Click color. Then what you are going to see here, you will see blood vessels is passing through the pedicle, and this is homogeneous, hypoechoic,